everyone, this is Island Nurse and welcome back to my YouTube channel. Now in this video, we're going to be talking about stroke or cerebrovascular accident. So let's begin. Now a stroke occurs when blood supply to part of our brain is interrupted or reduced, and this results in the brain tissue being deprived of much needed oxygen and nutrients. But why does our brain need oxygen? Now, if you recall in previous videos, we said that the brain controls all of the functions of the body. So from unconscious functions such as controlling our breathing, our digestion and heart rate, to conscious functions such as problem solving, thinking and judgment. So what actually happens is that when we eat, the brain relies on glucose, and glucose is converted into energy in order to power the brain cells to be able to perform their functions. So it means that if the brain cells are deprived of oxygen, we are unable to metabolize glucose, and if glucose is not metabolized, then the cells don't have the energy or the power that they need in order to perform their functions. What else happens when brain cells are deprived of oxygen? So within 30 seconds of being deprived, a person can begin to lose consciousness. Within 1 minute, brain cells begin to degenerate. Within 3 to 5 minutes, brain cells actually begin to die. And after 5 minutes, a person can actually die because of lack of oxygen to the brain. Now, the general consensus in the scientific community has always been that once brain cells die, they do not regenerate. Unlike cells in other parts of our body. So for instance, your skin cells are regenerated. That is why if you get a cut, in a couple of days, it's going to heal. Even if it might leave a scar, your skin still heals and looks as good as new. That is not the case with brain cells. This is what the scientific community has believed, that brain cells, once they die, they don't regenerate. However, there is new ongoing research that suggests that the brain does try to repair itself by producing new brain cells in a process called neurogenesis. However, this research is ongoing and is not yet conclusive. Let's move on to talk about the causes and types, and the types will give you an indication as to the causes. So we have three broad causes of strokes, or three broad types, I should say. We have ischemic strokes, which account for 80% of all strokes. Then we have our hemorrhagic, and finally we have transient ischemic attack. So let's start with ischemic. On the ischemic, there are two types. We have our thrombotic and our embolic stroke. A thrombotic stroke is caused by a thrombus or a blood clot that is in the artery or the blood vessel that supplies the brain with blood. And this thrombus can be formed because of plaque or fatty deposits that build up within the walls of the artery. And this is a process known as atherosclerosis, and this can happen because of a diet that is high in cholesterol. It can also happen because of lack of exercise or obesity. Secondly, we have our embolic stroke, and our embolic stroke is caused by an embolus. Now, an embolus is a blood clot or debris that moves from one part of the body and travels to the brain. So, for instance, a person who has deep vein thrombosis, where they have blood clots in the lower extremities, for instance, those blood clots can break off and they can travel all the way to the brain. Also, people that have atrial fibrillation, where the heart is not pumping effectively. When that happens, when the heart is not pumping effectively, blood tends to pool, and whenever you have blood pooling, blood clots are formed. So the blood can travel from the heart all the way to the blood vessels of the brain and cut off the blood supply. Now let's talk about our hemorrhagic stroke. And a hemorrhagic stroke occurs when a blood vessel actually leaks, or if the blood vessel ruptures totally. And when this happens, in the intracerebral hemorrhagic stroke, you have blood pooling within the brain tissue itself. In the subarachnoid, you have blood that pools between the surface of your skull and the brain. So in that space there, you have blood pooling. The person usually develops a sudden terrible headache. So some of the causes of the hemorrhagic stroke include high blood pressure or hypertension. You can have an aneurysm, which is a weak spot in the blood vessels, and this can also result from treatment with anticoagulants and antiplatelet drugs such as heparin or warfarin or even aspirin. And finally, we have our TIA or transient ischemic attack, which is also known as a mini stroke. So these types of strokes are caused by some of the same reasons why a person would have an ischemic stroke, but these strokes last for a very short time. It can last for as short as 5 minutes. The symptoms are not as severe and the person tends to recover very quickly. So now let's go on to talk about some of the problems that you're going to see in a person with stroke. So the first is speech problems, and the person has what is known as aphasia or difficulty communicating. So in receptive aphasia, a person might read words or they may hear sounds, but they cannot make meaning from the words or from the sounds, from what somebody else is saying. And in expressive aphasia, the person knows what they want to say, but they cannot find the words to express it. And this is usually very frustrating for the individual. And there's a third type of aphasia that's not listed here, and that is called anomic aphasia. And that is where the person is unable to use the correct words for objects. So you may place a pencil in the hand of someone and they're seeing it, but they don't remember that it's called a pencil, even though it's an object that they may be using every day. Another type of speech problem that we see in patients with stroke is apraxia. And apraxia is difficulty in using their muscles for voluntary speech. So for instance, a person might not remember how to form words. They might not remember the position in which they should place their mouth in order to form words. This tends to lead to difficulty in the rate and rhythm of speech, and also difficulty in producing the desired sounds that are needed for words. Now, the patient also has vision problems, and one of these problems is what we call hemianopia. So hemianopia is a situation where the person may only be able to see from one eye. So they may be able only to see from the left eye, or they might only be able to see objects from their right eye. And you have different variations. So for instance, you can have a type of hemianopia where the person can see from the left side of their right eye and the left side of their left eye. Or you may have another variation where the person is only able to see, let's say, from the right side of the left eye and from the left side of the right eye. And again, that is very frustrating to an individual. The person may also have anosmia, where they have difficulty recognizing objects or people. So they may have a relative that they have seen every day or that they live with, but they're unable to recognize the person's face. Also, this individual can have visual hallucinations where they're seeing things that are not even there, and they may also complain of having double vision, so their vision is blurred. Additionally, the patient may present with paralysis or weakness, and this is a classic symptom. This is usually one of the first symptoms that a person would recognize when they're having a stroke. So you might notice the person has paralysis or weakness on one side of the body, or you might notice the face start to droop on one side of the body. So this is a classic symptom. Another symptom that you might see is lack of coordination. You may also observe that the person has an unsteady gait or shuffling gait. They may have difficulty walking. They present with motor skill problems, so they're not able to pick up a cup or pick up a glass, whereas they were able to before. And finally, the person may complain of a headache, and it's usually going to be accompanied by nausea, vomiting, altered states of consciousness, and it's going to be a very sudden and terrible headache. And this is particularly prevalent with someone that has a hemorrhagic stroke. So there you have it. We've discussed the definition, the causes and types, and some of the clinical manifestations of a stroke. Now in our next video, we're going to be talking about the nursing management. What are you going to do for your patient that has a stroke? And like I always say, if you found this video informative, don't forget to like and subscribe. See you next time.